welcome to BBC Points West.
Our headlines tonight. The Bristol Children's Hospital under pressure. More parents claim that overworked staff have made catastrophic mistakes with their care.
If my son ever needs any heart surgery, he will never go to Bristol Children's Hospital again.
Police raids in Cheltenham today. They say they found women forced into prostitution.
No turning back. The motorists caught driving on the pavement to avoid roadworks.
And a tourist bus like no other as athletes enjoy their homecoming to Bath after the Olympics.
More families have come forward to express concern about the care their children received at the Bristol Children's Hospital. On Monday's programme, we told you about Luke Jenkins, the little boy who wanted to be a doctor. A report into his death blamed staff shortages on a bank holiday weekend.
Tonight we hear about Oscar Wilcox from Gloucester, treated on the same ward. He died aged 9 weeks. And 3-year-old Jack Casey. He had heart surgery in Bristol, but his parents say the aftercare he received has left him disabled. Our health correspondent Matthew Hill reports.
It's a miracle this 3-year-old is still alive. But Jack Casey's parents say the fact he can't talk yet or walk properly is down to clinical errors at the Bristol Children's Hospital.
If my son ever needs any heart surgery, he will never go to Bristol Children's Hospital again. The surgeon was fantastic, the consultant was fantastic, but the whole aftercare was just not acceptable.
When he was 7 months old, he travelled from Bridgend for a hole-in-the-heart operation. Within 2 days, Jack had a procedure like this to drain fluid from his chest, but the lining of his lungs was accidentally punctured. His parents first heard about the mistake from another doctor who is in charge of Jack's care.
He just came out furious, didn't he?
Yeah. He said, well, the doctor now has actually messed up doing this procedure. He's got to do a more risky procedure on Jack now to correct what she actually did, which would piece his lungs.
His parents held a meeting with the hospital after they complained about his care and say their doctor admitted mistakes were made. These minutes say that although the doctor in charge of Jack's care had never seen a chest drain puncture a lung before, it is a possible risk, and there was no obvious sign of an infection before the operation.
What wasn't documented on the minutes was that the consultant looking after Jack admitted to everything which happened to Jack should never have happened, and also that he was not fit for surgery.
His parents say they're also disgusted at the level of basic care Jack received in intensive care.
I actually found him in dirty nappies and laying there in his own vomit, with no nurse by him when he was in an intensive care unit.
And this mother from Gloucester says her 9-week-old baby Oscar had similar poor hygiene just before he died of a complex cardiac condition.
He'd be sick all over himself. Obviously, if we were there, we'd change him straight away, we'd change his clothes and his bedding. But there's been many occasions where we'd gone back to the hotel to go to bed and he'd be laying in his own sick. We'd come in and he'd be laying in his own sick, crying. And I was wondering, well, why didn't anyone come in and help him?
Well, Matthew is here now. Matthew, some very distressing stories there. What's been the hospital's response today?
Well, they have apologised for not responding to Mrs. White's concerns about the poor hygiene. They haven't commented, though, about the first child that we heard about in this report tonight, because they say of possible legal action. But having said that, I have just done an interview with the medical director of the trust.
Well, I'm profoundly disappointed and upset to hear these stories of poor care from patients and their families. We always strive to provide the highest standards of care, and it's disappointing when we don't, so we will learn from this.
The report into Luke Jenkins' death said that the staffing levels, particularly on Ward 32, were unsafe. Are they?
They're not unsafe. We staff our wards in accordance with the guidance from the Royal College of Nurses, and it's important also to remember that our outcomes are amongst the best nationally. We've been through a rigorous national process recently called Safe and Sustainable, and we know that our outcomes are amongst the best nationally.
But how can it be safe if babies, for instance, are lying in their own vomit?
As I said, we are very disappointed to hear of those stories, And that is not the standard of care we would wish anyone to experience, and we will learn from those standards, we will learn from those events and prevent them from occurring again.
Well, Matthew, he says they're going to learn from it, and that's something we've heard quite a few times. Are they short of staff or not?
Well, one of the original reports this week did point out that they felt that there were staff shortages at the time, early this year. Having said that, the spotlight has now been shone very firmly on this, so I would imagine they will be bending over backwards to make sure that there is adequate staffing, particularly as Bristol is going to be taking more patients in the future with other centres closing. They do stress that their results are excellent.
Okay, Matthew, thank you very much.